Have you ever felt lonely? Most people experience loneliness at some point in their lifetime, and anybody that has knows that it's like a pain. We as humans are fundamentally social beings, and in the same way that we have these innate biological motivations, such as feeling hunger is prompt to go get food, or feeling thirsty is prompt to go get a drink, feeling lonely is prompt to go get reconnected. And this social pain is being related not only to negative mental health effects such as suicidal ideation, depression, and anxiety, but also Alzheimer's disease, cognitive decline, and heart disease. The effects of loneliness have been compared in magnitude to that of obesity and even smoking 15 cigarettes a day. The UK has deemed it so serious as to appoint a Minister for Loneliness in 2018. But before we can put interventions in to tackle this issue, we first need to clarify who among the population is the most vulnerable of experiencing loneliness. But not only this, what type of loneliness are they experiencing? Researchers have actually found two distinct types: emotional and social loneliness. So, for example, have you ever been in a room full of people? You may know them, you could work with them, but there's no one you feel like you can talk to on a more personal level, that you really connect with. This is emotional loneliness, referring to the quality of your relationships. On the other hand, you may have someone in your life, such as an intimate partner or a family member, that you do feel you can really talk to. But if you've ever started a new job or a new course at uni or college, there may be nobody you know yet in a wider network to socialise with. This is social loneliness, referring to the quantity of your relationships. And both of these are shown to have unique causes and unique consequences. I'm pulling a multitude of demographics from nearly 2,000 participants, and using data analysis we'll see how each group uniquely predicts both of these types. And further we'll see how both emotional and social loneliness uniquely predict various mental health outcomes such as depression, PTSD and anxiety, in order to inform clinical workers so they can develop more effective interventions to meet people's individual social needs. So far in my research, we've surprisingly found that those aged 18 to 29 are more likely to be both emotionally and socially lonely than any other age group, which actually debunks the myth that older adults are the most lonely among us. Females are more likely to be emotionally lonely than males, and those living in city environments are more likely to be both emotionally and socially lonely than those living in country, rural environments. With 1 in every 5 people now saying they feel lonely, the impact of loneliness costing millions in the UK alone every year. And if there's one takeaway that we have in this current pandemic, it is the pain of being isolated from our loved ones. The results of my work seeks to inform clinical workers and indeed even the public on who's the most vulnerable, what are the risks, and the importance of feeling connected. Thanks very much.